So I got my mom on Ozempic and it was a game changer for her. But then she did get off. She was of that mindset, like, I got to the weight I want. I'm going to get off it now because she does love to eat, right? Yeah. She's a live to eat person also. And then immediately gained the weight back. Her knees were killing her again. All of it just started happening again. She was pre-diabetic. And so she decided to go back to a new clinic and they now gave her a newer medication. And she feels like she's not losing the weight as fast as she did when she originally started taking, but they switched it. So what is it that's happening?
Well, so these newer medications, tirzepatide, they're actually more effective. So for people who have been on Ozempic and let's say they hit a plateau, then I will often change them. Here's the problem with these medications, which I don't think most people know. What we've come to realize is that if you go on a medication, you take a drug holiday for whatever reason, and then you restart it, they become less effective. People don't realize that. So they start a medication, they stop it. They start it, they stop it. They think that they can kind of restart at any point and have the same reaction and just as easily lose the weight. It doesn't happen. People have to be ready to make the changes and to take it seriously when they initiate these medications, because it can potentially reduce the success later on.
When you actually need it too, especially like the people who are doing it for vanity reasons, which I'm not judging because I do lots of people, everyone watching knows I do a lot of things for vanity reasons. So I'm not judging at all, but that would make me stop to think, maybe I should not just like microdose this to get to my holiday next month or something if I'm going to eventually potentially really need it for my health, right?
Yeah. So all these things, they haven't done clinical trials, but we see it in real time that oftentimes when you start the medication, it's most effective, you feel it, and then all of a sudden you retrial it and you're like, I don't get that same sensation. Yeah. I don't think we understand the mechanism because the medication's out of your system by then, but it happens. Now, the other thing though, with these newer medications, because they have less GI side effects, sometimes with like the semaglutide, people will get nauseated and that's their cue to stop eating. With these newer medications, they are more effective for many people, but they don't get that nausea. And so it's harder for them to say, okay, it's time to stop eating. Some people need a little bit of those side effects to trigger them to stop. So everyone's different.
So then should people just assume that when they're going to start this medication, they're committing to a lifestyle? Like this is their medication?
I mean, yes, people not necessarily committing to a life of the medication, but committing to lifestyle change for the rest of their life. That's the important thing. So I have some patients that have come off the medication and they're doing great. So it doesn't mean someone's going to need a medication for forever, but they were developed for long-term use. So if someone says, okay, I'm under the expectation I'm going to take the injection for 3 months, I'm going to lose 15 pounds, and then I'm going to call it a day. I say it's really probably at least a 6-month, closer to a year or 2-year commitment to really doing the medication. As long as you tolerate it, we get you on the appropriate dose, because you're not going to change your lifestyle in 3 months.
No, I mean, who really changes their lifestyle even after, especially if you're using a medication?
Yeah.
I feel like the training of a lifestyle, you're saying this is like a life of habits that you've formed.
Yeah.
I can't imagine I would change my habits in 3 to 6 months.
Yeah. I mean, some people can. I think they see the results and they're just like, you know what, this is a non-negotiable. I have to continue. But I also, everyone that comes into my clinic, they don't get a script, right? Like I don't sell weight loss.
Yep.
I promote overall cardiometabolic health. What brings people through the door is they want to lose weight. My goal, listen, I can get anyone to lose weight. If I calorically restrict you, I get you to do tons of cardio and I max out your dose, you'll lose weight. I want you to have long-term success 5, 10, 30 years from now.
Yep.
And how do I do that? It's the behavioral change. The issue is that takes time. It takes expertise. It takes patience. And the way that healthcare is currently set up, you get maybe a 30-minute new patient visit, and then I'll see you in 6 months.
Yep.
So we make you figure it out and say, okay, here's the medication. You got to just figure out how it's going to work for you. And then I'm not even really titrating your medication. So
what's titrating?
Yeah. Okay. So every month we can either go up, keep you the same, or go down on the dose. Okay. These medications require a lot of hand holding, but in the typical healthcare scenario of my prior job, I had no room on my schedule. I was the only one that did medical weight loss. So I would see patients every 6 months. How in the world do I expect someone to change their behavior? If I write them a script, I had 40 minutes to learn everything about them, educate them, give them a plan. They'd say, Doc, I'll see you next month. I said, I'll see you in 3 to 6.
Yeah.
So we blame the patient when it's the faulty healthcare system where we're not giving the time for education and guidance and hand-holding.
Okay.
And that's what my practice allows now. But the easiest part of my job is writing that script. The harder part is meeting with patients once a month to say, what are you eating for protein? Right? And they'll say, oh, I think I'm hitting 60. I go, I need you to take me through your day. I need to know portions. You need to send me pictures. All those things, it takes time. It takes investment from both the healthcare provider and the patient. It is a big commitment that not everyone is ready to make.
Yeah.